Welcome to today's webinar, Introduction to Preventative Controls for Human Food for Very Small Value-Added Food Processors. This webinar is part of the Cultivating Success program, and Cultivating Success is a partnership of University of Idaho, Rural Roots, and Washington State University. Today's presenter is Stephanie Smith. Stephanie is a consumer food safety specialist with Washington State University, and she is one of our educators on the Preventative Controls for Human Food rule. We're really excited to have Stephanie on today's webinar. I'm Colette D. Phelps. I'm with University of Idaho Extension in Community Food Systems, and I'll be moderating today's webinar. Just a few tips before I turn it over to Stephanie. If you're having any problems with speed or sound, you can always type something into the Q&A box and I can let you know if your technical difficulties are on your side or something that we're experiencing with the overall program. However, it is pretty helpful if you close other programs on your computer so you can dedicate all of your bandwidth to the webinar. If you are having problems with sound, in your welcome email, there is a call-in number and you could go ahead and call in. If you call in, please mute your computer so you don't get feedback. In the bottom control bar of the webinar, you will see that there's a question box. At any time during the webinar, you can type a question in for Stephanie. I will make sure that there's an opportunity either during that part of the presentation or at the end of the webinar to answer your question. I did email out handouts earlier today to the email that you used in your registration, so you do have a copy of all of Stephanie's slides. The handouts will also be posted on the website with the webinar recording, and at the end of today's webinar, I will show you those details. So with that, I'm going to stop sharing my screen and go ahead and hand over the presentation to Stephanie. So Stephanie, you are welcome to take the screen.
Great, thank you. Can you hear me okay?
I sure can.
Okay. Thank you all for joining us today. We're going to talk about preventive controls for human food and just give an overview of what that is and what the requirements are for that and how that also applies to very small value added food processors. Please do not hesitate to ask questions if any come up during this webinar. And I'm also going to apologize in advance. I'm at the tail end of having a cold, so hopefully I won't cough too much during this, but I apologize if I do. Okay, with that, we'll get started. As I mentioned, we're going to talk about the Food Safety Modernization Act, commonly referred to as FSMA, and more specifically about preventive controls for human food requirements. And we'll talk about both the exemptions and the requirements. And then we'll go through the fundamentals of the preventive controls for human food rules. So this includes overview of the food safety plan, doing hazard analysis, and what that entails, putting preventive controls into place. We'll briefly touch upon supply chain programs and then talk about recall plans, updated GMPs, and employee training requirements. So what is preventive controls for human food? So we'll start out by saying that the Food Safety Modernization Act was a sweeping law that was put into place in 2011. And this law really focuses on preventing foodborne illness from occurring in the first place. Most of the time in the past, the regulatory agencies were focused more on coming down after there was on processors after a foodborne illness outbreak had already occurred. So this really allows both companies and regulators to be more proactive in preventing foodborne illnesses from occurring. So the Food Safety Modernization Act is composed of 7 different rules, and I have those listed here, but it ranges everywhere from produce safety rules, so the growing, harvesting, packing of produce, to actually doing food processing. There's rules for animal food. There's rules regarding foreign supplier verification programs, third-party auditors and certification bodies. The rules also cover sanitary transport of human and animal food, and then preventing intentional contamination or adulteration of food. So, of course, during this webinar, we'll be focused on the preventive controls for human food rule. And really what they're trying to do is prevent food safety hazards and foodborne illnesses across the entire food systems. I'm going to talk a little bit now about enforcement and compliance and some of the sweeping effects of this regulation. So first of all, this regulation mandates inspection frequency. So all high-risk domestic facilities have to be inspected within 5 years of the enactment of this rule, which we'll talk about that a little more in a minute, and then no less than every 3 years thereafter. The FDA has, or the regulatory agency that's doing the inspections for FDA, will have access to records, including food safety plans and how businesses are implementing those plans. There's some requirements for certain food testing to be carried out by accredited laboratories. This is still actually a work in progress. Last I checked, FDA was still working out the requirements for the accredited laboratories. Also, the regulation provides the FDA with authority to issue a mandatory recall, so they weren't really able to do that before. Now FDA can force a company to recall food. The FDA can also detain products that are potentially in violation of the law, and they can suspend the registration of a facility if it determines that the food poses a probability of causing adverse health consequences or death. The rule also provides enhanced product tracing abilities, so being able to track down food both on the domestic level and food that's been imported domestically. And then there's additional record keeping requirements for high-risk foods. Additional enforcement and compliance regulations include importer accountability. So importers have to verify that their foreign suppliers have adequate preventive controls in place and make sure that the food being imported is safe. There's also some regulations regarding qualified third parties that can certify foreign food facilities and make sure that they're complying with the U.S. food safety standards to help with the entry of imports. Also, the FDA has the authority to require that high-risk imported foods are accompanied by a credible third-party certification or some other assurance that they are in compliance with U.S. food safety standards. There's also a voluntary qualified importer program under this regulation that allows for expedited review and entry of foods from importers. And then the FDA can also refuse entry into the entry of food from importers into the U.S. If they need to, if they're not in compliance with U.S. regulations. So the biggest question we're always asked with preventive controls for human food is, are you in or are you out? Do you have to follow the regulations or are you exempted? So the basic requirements state that if you manufacture, process, pack, or hold human food for consumption in the U.S., that you are required to comply with these regulations. So very small businesses are considered those that average less than 1 million per year in annual sales, and they needed to start complying with the regulation as of September 18th, 2018. Small businesses are those with less than 500 full-time employees. They were required to begin complying with the regulation in 2017, and large businesses are all others. And they began complying with these regulations in 2016. So when we talk about the amount of sales, such as very small businesses averaging less than 1 million per year in annual sales, this includes the market value of food that's manufactured, processed, packed, or even food that's held without sale. And these amounts are adjusted yearly for inflation. Now, having said that, there are some exemptions or modified requirements to the rule. So qualified facilities are businesses that average less than 1 million. And so this is the average annual monetary value of the food manufactured, processed, packed, or held at a facility that is sold directly to qualified end users that exceeds the average annual monetary value of the food sold by such facility. So I did make some changes to this slide just for clarity. It's the same information that you would have on the packet that Colette sent out to you, but I've just kind of try to clarify this a little bit. So when in the first part of what you would have, the requirements for what you have to meet for this regulation, basically it's saying that the average sales of the food that's manufactured needs to be sold directly to a qualified end user. The majority of it has to be sold to a qualified end user. So that means over 50% of all food sold by the facility needs to go to a qualified end user. So what is a qualified end user? That is a direct sale to consumers, a local retailer, restaurants, or an Indian reservation. And those sales have to be either within the same state or within 275 miles of the facility. And it also includes both sales of human food and the market value of the human food that is manufactured, processed, packed, or held without sale. So for instance, held for a fee. On top of that, you also would have to have average annual monetary value of all food sold during the 3-year period preceding the applicable calendar year has to be less than 500,000, is adjusted for inflation. So it's the average per year during the 3-year period preceding the current calendar year. So to get an exemption from the rule and have modified requirements, you need to meet both of these parts of the regulation, these two requirements. So number one, the sales to qualified end users, and then number two, the average annual monetary value is less than 500,000 is adjusted for inflation over the 3 years preceding the current calendar year. And I know that can be a little confusing, so don't hesitate to ask questions if you have any. If you do qualify for an exemption, you still have requirements that you absolutely must meet. So number one is you're required to notify the FDA about your status and attest that either you're addressing any hazards, which we'll talk about in a few minutes, through putting preventive controls in place, and that you're monitoring the preventive controls, or that you're complying with applicable non-federal food safety regulations and notifying consumers of the name and complete business address of the facility where the food was manufactured or processed. So this is really going to depend on what type of business you are. If you're doing something more in the cottage foods area, you might have to be complying, for instance, if you're selling jams or jellies, you might be complying with your local health district regulations, or if, for instance, in Washington State, you might be complying with WSDA requirements, which are then actually following the FDA regulations. And again, it really just depends on what type of business you are and what you're selling, but those are the requirements. On top of that, you have to submit these notifications to the FDA and you have to register your facility. If you do not If you're an otherwise qualified facility and you do not notify FDA, then you're subject to the requirements for hazard analysis and preventive controls. So you would have to comply with all the requirements that we're going to talk about. If you do not submit your, if you do not submit the information to the FDA for your business. On top of it, you must follow conditions and practices for processing safe food under sanitary conditions. So these are known as current good manufacturing programs. And so this includes this includes best practices and conditions for personnel, your food processing plants and the grounds around it. You must be processing food under sanitary conditions and have sanitary facilities and controls in place. You must meet equipment and utensil standards, and also have controls over your process, warehousing, holding, and distribution of food, including food that's byproducts that are going to be used as animal food. And then also have action levels in place so that you know when a food's out of compliance, and then have standards in place for how that food's going to be dealt with if something's out of compliance or if there's a defect. I'm now going to talk about the requirements for preventive controls for human food. So this slide just gives an overview of the requirements. Basically what it comes down to is you're supposed to look at the type of food you are processing and determine if there is a possible hazard with the processing of that food. So we'll talk more about different types of hazards, but basically you do what's called a hazard analysis. If you identify a hazard, then you need to put preventive controls into place. And with the preventive controls, you need to set different parameters and values for what's going to be acceptable for that food to ensure its safety. And then you need to do monitoring to make sure that those parameters and values are being met and that your controls are actively controlling for those hazards. And then if during your monitoring you determine that there's been some sort of action or some sort of error that causes an issue with the food, then you need to have corrective actions put into place and make corrections and determine what's going to happen with that food. And then you also potentially need to go back and reassess your hazards and put new preventive controls in place if the ones that you have in place are not adequately controlling for hazards. And then throughout all of this, you need to be doing verification of the process and then keeping records. So that's the overview of preventive controls. A few more things that are really important is that putting all this together, you end up having a food safety plan. And we always tell people that when you're developing your food safety plan with identifying the hazards and your preventive controls and your monitoring, all those steps, they really need to be specific to a facility. You cannot take someone else's food safety plan and apply it as your own, even if they're making the same product, because the controls are really specific to each individual product, each ingredient, and each process and each type of equipment. Sometimes products can be grouped together if the hazards and controls are going to be the same. So for instance, if you're making a sugar-free jam and a standard full sugar jam, then the hazards and controls, generally will be the same for both of those products. Also, with a food safety plan, you need to really define and address the specific products that are being made and the processes that are specific for those products. You need to identify which parts of the food chain you need to study to determine what preventive controls need to be put into place and what hazards might be present. And then after you do that, you need to look at each of the biological, any other potential hazards. And these generally include biological hazards, chemical hazards, including radiological hazards, and physical hazards. And we'll go through all these in more detail in a minute. So what's in a food safety plan? Well, what's required is that you have your hazard analysis in there that you've performed, that you've listed your preventive controls. So again, if you've identified a hazard that is going to need a preventive control, then you need to list what those preventive controls are. And these can be either process controls, food allergen controls, sanitation, supply chain, or any other controls that have been identified to reduce the risk of that hazard. And then you absolutely must have a recall plan in place. Additionally, the food safety plan must have procedures for monitoring, corrective action, and verification. Some other things that are useful for putting into your food safety plan is a facility overview and a list of your food safety team, including their contact information, so that if you do ever have an issue or you do have to initiate a recall, all of that information is readily available. It's also useful to have a product description and a flow diagram of both the process and even going so far as the flow of the food throughout the facility, and then also a process description. Generally, in a food safety plan, there's some major organizational sections that you want to have. So the first section that you wish to have, that you should have in your food safety plan, is your background information. This is optional, but just whatever information you have about the facility and the product can be helpful to have in the food safety plan. The second section is your hazard analysis, and we'll talk more about each of these parts individually, but that should also be a major section in the food safety plan, along with your preventive controls that you're putting into place, your recall plan, and then your implementation procedures. So how are you going to do this? What are your corrective actions? Who's responsible for carrying out these procedures? All that information should be in the food safety plan. So we're now going to discuss the more specific aspects of the preventive controls for human food rule. So the first part we're going to talk about is hazard analysis, and what exactly is hazard analysis. So basically, you must identify any known or reasonably foreseeable hazard associated with your food. So for example, ready-to-eat foods, we know that the product's a potential risk for listeria. So in that case, you must control for listeria if it meets the definition for potentially harboring listeria. Then you have to determine if those hazards are going to require a preventive control. So the hazard analysis, as I've stated on the slide here, is the process of collecting and evaluating information on hazards and conditions leading to their presence to decide which ones are significant for food safety for your product and must be addressed in your food safety plan. So more specifically, what is a hazard? So as I've previously mentioned, a hazard can be any biological, chemical, or physical agent that can cause illness, potentially cause illness or injury. And this includes a known or reasonably foreseeable hazard. So they give an example. One example of this is if another facility has had issues with, say, we'll just say salmonella in peanut butter, and you're making a type of nut butter, maybe it's not salmonella, or maybe, I'm sorry, maybe it's not peanut butter, but it's another type of nut butter, um, that that too might also potentially have a hazard to be contaminated with salmonella. And so that might be something where it's a foreseeable hazard. Maybe it hasn't already occurred in that particular type of nut butter, but it's a hazard that's occurred in other nut butters and might need to be addressed. Here's a list of some different types of hazards. So biological hazards are generally those that are caused by bacteria, viruses, parasites, or fungi. Chemical hazards include allergens. So even, most allergens are from biological sources, but those are considered actually a chemical hazard. And then, of course, specifically different types of chemicals, whether it's something like lead or arsenic, all the way to pesticides or other types of residues. For example, in some areas, there might be high amounts of arsenic in the soil. So if you're making some sort of fruit or vegetable product, then there might be an arsenic hazard potentially with the food that you might need to address. And then, of course, radiological hazards. Physical hazards can include glass, rubber, metal, plastic, small stones. There's a lot of different things that can cause physical hazards. So if any of these are potential hazards for your product, then you need to be able to address these and prevent the risk. So when doing hazard evaluations, you want to consider the formulation of the food, the type of facility and the equipment being used, what your raw materials are, who you're getting them from, if there's any hazards associated with those. Transportation practices can be a big one as well. So whether stuff can leak or drop into the product, or broken fragments from shipping containers, or the packaging holding the product can be an issue. Processing procedures, including whether a product can be reworked or not, to allow it to address any potential hazards and result in a safe product that can be delivered to the market, needs to be considered. Packaging and labeling activities is a big one. A lot of times food ends up being recalled because it was labeled incorrectly. So that can be a potential hazard. The storage and the distribution of the food. Intended or reasonably foreseeable use is another really big one. A lot of times consumers do weird stuff with food. So we always talk about, even if a food product, if you're making a food product and it's not intended to be used in a certain way, if a consumer is going to use the food in that way, you need to be able to address that hazard. So we talk a lot about, there was a big produce recall, frozen produce out of Tri-Cities, and the produce was recalled for listeria contamination. So with frozen produce, the company generally assumes that people are going to be cooking that produce, but a lot of times people take a product like frozen peas and just add it directly to, some sort of pasta salad or other cold salad without actually cooking those peas. Well, even if you intended for those peas that you packaged and then froze and sold to consumers, even if you intended for them to be cooked, if you know that consumers are using those peas without cooking them, then you need to address that hazard. And then also sanitation issues need to be considered, and then any other relevant factors that might result in the food becoming unsafe need to be addressed. You also need to evaluate the likelihood of something happening. So this slide just gives some examples of that. So for instance, I already mentioned past foodborne illness outbreaks is a really big thing to consider. So if there's been previous outbreaks associated with a food that you're producing or a similar food, you need to take that into consideration. If there's recall data from similar products, there's a lot of scientific literature that's available that can help you with doing risk evaluation or your hazard analysis. Any historical information from the establishment or even your importers establishments, regulatory guidance, and then trade association information is really helpful. They have a lot of good information available about different products and can really help you with doing hazard analysis on your product. And then of course, university extension documents. So we're going to move on now to actually talking about preventive controls. So again, if you do a hazard analysis and you've identified a potential hazard that needs a preventive control, then you have to develop and implement a plan to significantly minimize or prevent the hazard. So there's a lot of different preventive controls that you can put into place. These might be process controls, allergen controls, sanitation controls, or any other controls as needed or as you've identified. And we'll talk more about these as we go through the slides. So here's some examples for biological controls. So we talked about those might be viruses, parasites, bacteria, fungi. A process control that you might put into place to control hazards of biological origin might be just cooking a product to a correct temperature to kill the microorganisms. So that could be a simple control that you put into place. If you're trying, if you decide that your process control is going to prevent the growth of the organism, then you might do other things like reduce the pH of the product to inhibit microbial growth, or even reduce the water activity as well, so that of the product, so it won't support microbial growth. Some other things you can put into place too are supply chain programs, so making sure that the food that you're getting in is from a supplier that also is putting preventive controls into place. So if you already know that a preventive control has been put into place by your supplier, then you may not necessarily need to address it because it's already been addressed. Or you can put sanitation controls into place, such as, regular cleaning and sanitation of your facilities. Chemical process controls, supply chain programs can be a really important control that you put into place. So again, making sure that you're getting your products or your raw materials from a supplier that is following these food safety regulations, putting sanitation controls into place, and dedicating equipment that can be really important, especially with your allergen controls. So making sure that if you're producing a food that contains allergens and maybe a food that doesn't contain allergens, that you're keeping those products separate. So if you're producing two products, they're both similar, but one has nuts and one doesn't, then you might consider dedicating equipment to each of the different types of products so that you can reduce cross-contamination risk. Allergen labeling is really important, making sure that those are in place, and even doing ingredient testing yourself to make sure that the ingredients you're getting in don't contain those hazards. For physical process controls, a lot of times you see companies using metal detectors, x-rays, or filters to remove any possible physical contaminants in the product, or at least be able to identify them if they are in the product. There's been a lot of recalls for different types of physical hazards like metal shavings or, you know, chunks of plastic or rubber. So there's different controls that can be put into place to prevent those. Okay, what does your process controls have to have? You need to have parameters, so both minimum and maximum values. So for example, if you're going to heat a product to a certain temperature to control, to have a biological control in place, your parameter might be to heat the product to an internal temperature between 160 to 165 for a minimum of 30 seconds. So that might be your parameters. You need to do monitoring. So for example, your monitoring control might be to check that the product temperature on 10% of the products is tested using a calibrated thermometer. Your corrective action might be something like, if your product temperature is out of range, what are you going to do? Well, maybe you're going to adjust the equipment cooking temperature and reprocess the product. And then for verification and validation steps of your process controls, you might want to verify that the corrective action worked, validate a process to make sure it's effective at killing pathogens. Some records that you might need to keep, for example, might be thermometer calibration records, reprocessing records, product temperature logs. So these are some examples for process controls and what you would have to have at each step. For food allergen controls, there are, here's some examples of what you might have in place for allergen controls. So for monitoring, you might put into place that you're going to check that the correct labels are applied that identify that there is an allergen in the product. You might want to use dedicated equipment or do appropriate cleaning for allergen removal before processing another product that does not contain that allergen. Or you might have supplier verification in place to make sure that your product does not contain any allergens. A corrective action that you might put into place is, if a wrong label is put on the product, then you would identify that, of course, through your monitoring. And then you might just, as a corrective action, just relabel the product, or you could destroy or divert contaminated product. For verification, the verification step, you would want to verify that your corrective action worked. So if the wrong label was placed on a product, that it was removed and the correct ones were applied. And then for records, you might want to keep records that a deviation was identified, that was remedied, and the corrective action was implemented and effective. So talking about allergens, there's what we refer to as the big 8 allergens. These absolutely must be labeled. These 8 allergens cause approximately 90% of all food allergy reactions. And these include milk, soy, tree nuts, shellfish, wheat, peanuts, eggs, and fish. So if you're making products if you're making a food product that contains these ingredients, then you have to label that food product that it contains these allergens. There's been some more recent talk of actually expanding this list to some other products that cause a large number of allergic reactions. But so far, this is the big, we're sticking with the big 8 for right now. Okay, sanitation controls. These are procedures, practices, and processes to ensure that your facility is being maintained in a sanitary manner to control a hazard. So, for example, of sanitation controls for monitoring, you might do regular swabbing of your facility and have a protocol in place to detect listeria, for example, if listeria is a potential environmental hazard in your facility and a potential contaminant of your food. A corrective action that you might put into place is that if you have a positive result for Listeria, you might hold the product for microbial testing, do re-cleaning and sanitizing of the equipment, redo your swabbing protocol, and ensure that everything's been properly cleaned and sanitized and that your Listeria test is now negative before you start processing again. Your verification step might be retesting and continuous testing for Listeria species to make sure that you have control of preventing Listeria from entering into the facility. Some records that you might want to keep would include things such as your environmental monitoring records, such as what areas were swabbed, the time and date they were swabbed, who did those, what were the test results, and if any corrective actions need to be put into place, what were those corrective actions and how were they applied and were they successful? Excuse me. We're now going to move on to talking about the risk-based supply chain. So if a hazard is related to ingredients from a supplier and you depend on the supplier to control the hazard, then you must have and implement a supply chain program, and you must also perform verification of that program. So we'll talk more about this. So for the risk-based supply chain, you have to use approved suppliers and determine what your needed supplier verification activities are going to be. So these could include doing actual on-site audits, reviewing the supplier's records, how they're testing the product or processing the product. And then you may also wish to do sampling and testing of the materials on your own to make sure that the products you're receiving are indeed meeting the requirements, the preventive control requirements. And you may also want to conduct supplier verification and then document, go through the documents that are provided to you by the suppliers, or at least request these documents from your suppliers. So copies of any of their records, including any inspection or audit records, copies of laboratory results that they obtained for your product, and then when they've done sampling and testing of the products and the types of products that were sampled and tested, and of course the results for those. The next step we're going to talk about is the recall plan. So if the hazard analysis that you performed identifies a hazard, you absolutely must have a written recall plan in place. So the recall plan must include procedures for conducting your recall, steps to perform a recall, and assignments of responsibilities for doing a recall. So the recall plan steps would involve notification to the regulators. That would be the first people you want to contact. And then notify anybody that's received your product of the recall that's taking place. You want to have a disposition of the affected food, a public notification, and then also verifying that the recall that you performed was effective and that you were able to get the food off the market. Okay, so here are some resources for preparing your food safety plans. First of all, some good resources are your personnel. Those are, some of the first people you might want to go to. So these might include consultants that you have available, different auditors or auditing companies, employees that you already have on staff that have food safety backgrounds, process authorities, and then of course your suppliers can also help you with preparing your food safety plans. There's a lot of reliable internet sources available. You want to make sure they're reliable, but this might include the FDA website. There's a lot of information that FDA has made available to food processors. The FSPCA website can be very helpful, and also other government agency websites. So for instance, your local state department of agriculture might have a lot of information available. So don't be afraid to reach out to them. A lot of times people hesitate to reach out to the regulators because they're afraid that they're going to end up getting themselves in trouble. But FDA and also the state agencies are really trying to educate food processors, more than, come down hard on food processors. They want you to be processing food safely. They want to be able to help you to do that. So do not be afraid to reach out to them. Another place to go when preparing your food safety plan is looking at different publications that are out there. So there's a lot of peer-reviewed literature that's available. FDA, again, has a lot of publications and guidance documents. And then, of course, trade association publications. And last but definitely not least, don't hesitate to reach out to your state extension offices. They can provide you with a lot of information or direct you to other extension faculty or staff that can help you with preparing your food safety plan or help you get publications or provide you with some background information. So please do reach out to us. One more rule that's really important to talk about with preventive controls for human food is that there's a requirement for a qualified individual. So what a qualified individual is somebody who has successfully completed training in the development and application of risk-based preventive controls. The training must be at least equivalent to that received under a standardized curriculum. So for example, taking the FSPCA preventive controls for human food 2.5-day training would allow an individual to then be considered a qualified individual. Or alternatively, you can become qualified through job experience to develop and apply a food safety system. So the rule requires that the food safety plan must be prepared or overseen by a preventive controls qualified individual. So that's why you need to have at least one individual in your facility who's met one of these requirements. We generally tell people to just take the 2.5-day training. You'll get a lot of information and they can really help you get started with building your food safety plan. Another thing to know about the preventive controls for human food rule is that there are updated GMP requirements. So number one is training. The employees must be qualified to perform their assigned duties and be trained in the principles of food hygiene and safety. So everybody, all employees have to be trained in the principles of food safety. And you also must keep training records. So the FDA or the other regulatory agency will ask for training records. So you need to maintain those. With regard to allergen cross-contact, you must have employee practices and procedures in place to control allergen cross-contact. And then there's also new provisions for holding and distribution of food byproducts that are going to be used for animal food. So these are going to be really important to make sure you're complying with. Even if you're a qualified exempt facility, you still need to be in compliance with GMP requirements. So in summary, the preventive controls for human food rule covers the manufacturing, processing, packing, or holding of human food. Facilities should already be in compliance if they're not exempt. And again, even if you're exempt, there's still certain rules that you need to be in compliance with, such as registering your facility and keeping documentation showing that you're exempt, and then also following GMPs. Again, your extension, your local or your state extension offices and your state agricultural departments or your regional health departments can help you determine if you are exempt or covered under the rule. And again, even if you're considered qualified exempt, you have to register. I already said this, but just to reiterate, you have to register with FDA, follow current GMPs, keep paperwork records showing sales and any other records proving your exemption. And you still have to label the food with the name and complete business address of the facility where the food was produced or processed. If you are covered under the rule, of course, you have to have a food safety plan and go through all the steps we've already talked about, but you also must have a preventive controls qualified individual to oversee the food safety plan. And it's best if they just take the standardized 2.5-day training. And there's many resources available. So again, do not be afraid to reach out. We're all here to help you be in compliance with these regulations. Here are some resources that you may wish to visit. And again, don't hesitate to reach out to us if you have any questions.
Thank you for that really in-depth and great presentation, Stephanie.
You're
I'm going to go ahead and share my screen and encourage everyone that if you have any questions to please put those in the chat. And so there's just a couple questions so far, Stephanie. The first one is, who monitors or inspects and enforces this preventative controls for human food for very small producers? So who is it that's going to follow up and make sure that you are doing those, GMPs, or that you have, actually filed your paperwork that says you have a qualified exemption?
It's really going to depend on the type of food that's being processed and where it falls, who the regulatory authority is for that food. So, for example, in Washington State, with us, WSDA, Washington State Department of Agriculture, is the regulatory agency for doing the inspections. And so they would be the ones doing it. In other states, they are leaving it up to FDA. So FDA will be coming in to do those inspections. So it's really dependent on the type of food that's being processed and what state you're in and what the regulatory body is for that state. So it's quite variable.
So perhaps one of the best things that very small processors could do would be to contact their local or regional health department and ask that question about who is overseeing this within their state, and just really make sure that they understand how this is going to affect them and who their resources are within their state.
Right. And even if they call, for instance, the regional health department and, they're not the correct people, then they should at least be able to direct you to whoever it is that is responsible for regulation in your state.
Okay, great. Thank you. We have another question, and it's a clarification. If somebody is qualified exempt, are they still required to take the 2.5-day training certification for their operation?
So if you're qualified exempt, then you do not need, so if you're qualified exempt from that, then you just need to have the file with the FDA, and of course have your GMPs in place. We still recommend that people take the 2.5-day training certification. The training focuses more, on putting the preventive controls plan into place, but we still actually highly recommend that people take it if they can, because there's a lot of really good information, and it can help you, make sure that you're putting the best practices into place to control your processes and your food processing, even if you are exempt, even if you are qualified exempt.
Okay, I went ahead and put the qualified exemption requirements up again on this slide, and it seems to me, and you can correct me if I'm wrong, Stephanie, that one of the best ways to make sure you're covering all of these bases is to develop a food safety plan that covers all of these different aspects, and then within that identify how and where you're keeping records so
Yes.
that you're able to make those available if you are asked to make them available to document that you are doing the GMPs.
Yeah, most definitely. I mean, it's a good idea to have your food safety plan in place anyways. And so taking the 2.5-day training certifications just can be really helpful with that and help you identify that. Especially if you're a new processor, there's a lot to learn. And so, the course goes through all these different things. And so even if you don't have to have follow the full requirements, it can really help you with making sure that you're covering all your bases and following even requirements for the GMPs for sure.
Okay, thank you. So there's a couple different scenarios in our region, especially with very small processors that we see. And I just wanted to share what those scenarios are and then to ask within those different scenarios if the dollar amount that you're looking at in terms of value-added sales, so looking at the sales of your processed items, if you're only tracking those value-added sales or if you're looking at the sales of your entire business. So for instance, many farms are raising crops, but they might have a value-added side product. Another situation we see are there's small retailers that start to develop a value-added product that they make available through their deli or their retail outlet. And another one that we often see are restaurants that have perhaps like a special sauce that their customers are really excited about. So they take that and they start to actually develop that product for a retail sale. So within those different scenarios, how do you see this rule applying to those value-added businesses?
So, Colette, do you mind going back to, let me look at, let me identify which slide it was. Slide 8.
Is this slide 8? I don't have it here.
Yes.
Okay, great.
Okay, so this slide kind of addresses that. So with a qualified facility, so they talk about it includes both sales of human food, the market value of human food that is manufactured, processed, packed, or held without sale. So basically, all the food that's being sold. And then with and so when you're looking at it from the value aspect, it includes all those foods. And then again, it's also the average per year during the 3-year period preceding the current calendar year. So you have to have an average of less than $1 million adjusted for inflation, and then at least half of the sales have to be to consumers, local retailers, restaurants, or an Indian reservation within the same state or within 275 miles. So, so let me see. I think, yeah, Colette actually, yeah, it changed this slide for clarity, but so you have to have, if you're a very small business with your average sales less than $1 million, then over 50% of that food needs to be to either the consumers, local retailers, restaurants, or Indian reservation within the same state or within 275 miles. If you don't meet those requirements, then you would still, you would not be eligible for a qualified exemption. Did that answer your question?
I think it did. If I'm understanding correctly, if you are a restaurant, you're looking at your total food sales, so your restaurant food sales plus your value-added product food sales.
Yeah, they include all foods. On a specific restaurant, I would probably need to check. I want to check into that more to make sure that I'm correct about that and not give misleading information. But a lot of times when we're looking more at doing food sales, for instance, on somebody that's doing a value-added food product and that's also growing food, then again, we're still looking at the complete market value of the food. And that half of that
Okay,
has to be
great. Thank you so
going.
much.
Yeah.
Okay, I don't see that any more questions have come in, so I really want to thank you for today's presentation. I want to remind everyone that you can go to the Cultivating Success website to see upcoming programs, webinars, and other classes that are going to be available. For this month in February, we have 4 additional webinars that are going to take place. Next week, Stephanie's going to be talking about farm worker health and hygiene. And then we'll have a Tuesday webinar next week that's on Idaho irrigation and water rights. Then on February 24th, I'll be speaking about capturing consumer demand for local food and what some of the trends are that we're seeing. And then Tuesday, February 25th, we're going to be having an introduction to Quicken versus QuickBooks, so a record keeping 101. We hope that you can join us for one or more of those webinars. We do have a very short post-webinar survey that's going to pop up in your browser when we close the webinar today. Hope you'll take a few minutes to complete that survey. On average, that survey takes 3 minutes to complete. Your feedback will be very helpful. And if you have any things that you need clarity on, if you could please let us know in that survey, we will work to get those answers back to you. So with that, I want to thank Stephanie very, very much for this great webinar. Let you know again that you'll be able to find a recording of this webinar at cultivatingsuccess.org. If you have any questions, please go ahead and contact me. You can contact me through the Cultivating Success website. So thank you very much and have a really great day. Thank you, Stephanie.
Thank you, Colette.